Good afternoon, everyone. We would like to welcome you to this panel, which is dedicated to a very relevant discussion that is currently ongoing and has gained additional attention since the pandemic, and that is digital health. Digital health represents efforts to adopt digital technologies in the health sector and introduce new tools and solutions that can improve healthcare delivery and support. Of course, it is an umbrella term, which includes several layers of services that touch upon various elements of the health ecosystem. We are very much interested in this panel, especially in the use of real-world evidence data, which build on a tremendous amount of data that are being collected from various sources, also here in Greece, and seem to formulate a unique opportunity for value-added activities at various levels. At the research level, both public in hospitals and universities, and private, meaning the in-house R&D and business R&D. Second, at the health policy shaping and design, since through big data analytics, crucial patterns emerge, which can reveal aspects of public intervention. And third, digital health and real-world evidence offers value to the economy, as new jobs can be created and additional funding can be channeled to specific directions, and more funding can be attracted and established within the local ecosystem. In order to discuss these issues, we have our guests here will contribute with their insights on the topic. We will start with local public policy with the two ministers that we have invited here. And then we will hear some of the efforts that are happening in the field in other countries to better understand how real-world evidence data works. So I'm going to give directly the floor to the Minister, Mr. Vassilis Kontozamanis, which is the Deputy Minister of Health, for his intervention. Mr. Kontozamanis.
Thank you. Thank you very much for the invitation. Since the beginning of the COVID-19 pandemic event, our national healthcare system has fully coped with the challenges that arise. Winning the fight was made feasible by following a specific plan, strengthening the healthcare system and the capabilities of the system. And we strongly believe that real-world evidence and big data can become the catalyst towards this goal of strengthening more our healthcare system. We know that existing systems, in combination with the potentials offered through digital health, create many opportunities for the healthcare system, such as the monitoring of the health of the population for the development of the health map and setting societal health goals. Secondly, evaluation of healthcare service providers across the country based on clinical results. Third, monitoring the consumption of human health and financial resources within the healthcare system and the evaluation for optimal utilization of these resources. Monitoring also the implementation and evaluation of prescribing and therapeutic protocols and their improvement through adjustments. Moreover, assessment of international and national clinical guidelines and public health policies aiming at improving daily clinical practice and chronic diseases management. Also, develop patient registries enriched with clinical results and financial data. The last point in particular patient registries, can truly support our efforts dealing with COVID-19. And this is what we did during this pandemic. Mapping of the incidences as well as data analysis during the diagnosis and treatment allow us for increasing our readiness and effectiveness levels to treat patients in the most efficient way. The Ministry of Health, together with the Ministry of Digital Transformation, have already established the COVID-19 registry and plan to expand it in both in data collected as well as other disease areas. It is a great opportunity and we are going to grasp this opportunity. We really gained very significant piece of experience during this pandemic and we are not going to lose this opportunity. Also, big data and real-world evidence provide great potentials in promoting research in the country, both in terms of clinical trials and observational studies. We need to capitalize on these potentials and we are not only going to improve the healthcare system, but we can create alternative sources of funding and new job positions in the country. We estimate that we could bring on board more than 2,000 people that can work on real-world evidence and big data analytics. And this is very important for us, for the healthcare system, and for the economy in general.
Thank you, Mr. Minister. So you suggest that we have gained some experience through this pandemic, and this is something that we can build on for the rest and for actually exploiting all this data. So you think this is an opportunity we should never miss? We should not miss, huh?
Yes.
Okay.
I don't want to exaggerate, but we strongly believe as a government that during this pandemic, we managed to make this digital leap in the healthcare system. We did so many things in a very short period of time, and it is very important for us because we had planned for many e-health services, such as the electronic prescribing. We were about to deploy the e-prescribing system, the fully digitalized e-prescribing system during this year, but because of the pandemic, we managed to do it in a very short period of time. So we have gained much experience. We are going to exploit this experience and further capitalize on the opportunities that we have in the future.
It's like the cliche, and every crisis creates opportunities, so we have to, again, to capitalize on this. So, Minister Zarifopoulos, you, on the other hand, you designed the digital policy, so I would like to hear your insights on the topic.
Okay. Thank you for the invitation. Building on what Minister Kontozamanis just mentioned, we believe that Greece has gained from this pandemic on the following fronts. Has gained on the embracement of technology in the daily lives of the citizens, and through the effective use of this technology, the government has been able to build a new relationship between the citizens and the state. And this is what we should keep moving forward. As Minister Kontozamanis mentioned, we were obliged to expedite a lot of the things that we've been designing since last summer in order to be able to cope with the pandemic. But we had this strategy all along, and we worked on a plan that we just had to accelerate. Now, how do we move forward? People of Greece, citizens of Greece, have realized how technology can become an ally, how the use of data can help with the management of crises and can help with our daily lives. And we need to capitalize on this and move forward with further improvements in how we use technology in our lives. We have a unique opportunity, a historic opportunity, to do things that have never been done before in Greece and move forward with, for example, the personal medical record for each citizen of the country, a digital record that will actually be able to collect all relevant data for every citizen. And so every citizen will be able to access this data digitally, including all doctors and all hospitals. Greece is one of the few countries of the European Union that has a national e-prescription system. And we should leverage that. We should capitalize on this and couple it with this individual record, this national individual record for every citizen, a digital file for all medical records. I think this would be a huge reform in the sector of health, of e-health. And I believe now we have the experience, but also the momentum to move forward with that. Through this medical record, this medical file of medical records for every citizen, we will then be able to collectively exploit and use for the benefit of the citizens the vast amount of data that we will be able to collect. Obviously, this will be anonymized data, well protected, but through the through the analysis of this big data, we should be able to use this knowledge and protect ourselves and the system, the health system, for other pandemics to come in the future. So in a nutshell, yes, it was a very difficult period of 2.5, 3 months. It's still going on. Greece has done very well, and the government has coped with the management of this crisis. Let's keep the use of technology as a benefit that came out of this crisis, but let's exploit it further and move to more digital health solutions. I mentioned the personal medical record for every citizen, but there are other things that we should actually move forward with. Telemedicine solutions, for example, would be something that now we need to exploit further. Citizens realize the need for such solutions. And so we should build on this momentum and do more. Thank you.
Thank you, Mr. Zarifopoulos. Indeed, it's an opportunity for us. Indeed, a lot of the society and citizens have tried to grasp technology and try to implement it in their everyday life. So it is indeed an opportunity. So now we would like to give the floor to our guests, and we will start from Emeritus Professor Staffan Lindblad from Karolinska Institute from Sweden. Mr. Lindblad, the floor is yours. Sorry, we do not have Mr. Lindblad with us, so we should go directly to Clara Weil from Macchabitech, Israel, for insights on the topic. Thank you for being with us.
Thank you very much. It's great to be a part of the discussion today. I'm here representing Macchabitech, the research arm of Maccabi Healthcare Services. I'm afraid there's an echo here. Let me try this way. So I'm here representing Macchabitech, which is one of 4 non-for-profit HMOs in Israel, which represents 1/4 of the population. Now, since the early 90s, Maccabi has been a leader in digital transformation and innovation. I'll provide a brief overview of Maccabi's approach to digital health and how we've harnessed real-world evidence in the management of COVID-19 and beyond. Israel, like Greece, was quick to implement strict measures to help control the spread of coronavirus. To date, there have been more than 17,000 cases in Israel and close to 300 deaths, in a population of over 8.5 million. This left Israel with one of the lowest case fatality rates in the European region. Professor Gabriel Chudek, who leads research at Macchabitech, analyzed some of the cross-country differences and observed that much of the variation in COVID-19 incidence and mortality in this region is associated with nations' economic development. Interestingly, the worst hit countries were those with the highest GDP per capita, really those with the most tourism and mobility. So now as Greece, Israel, and other countries prepare to reopen tourism, we'll need to apply lessons learned so far in the pandemic. In Israel, the initial response to COVID-19 was managed centrally by the Ministry of Health, and by May, the 4 HMOs largely took over the testing and care. Thanks to its existing digital health tools, Maccabi was able to rapidly organize its response to COVID-19 while continuing to provide essential services to the general population. Maccabi quickly rolled out test centers, including drive-through and mobile units, which provided results within 24 hours. Meanwhile, virtual visits and home delivery of electronic prescriptions allowed everyone access to care from home. Quite soon into the outbreak, Maccabi members also received text messages with questions about potential COVID-19 symptoms. So in addition to an anonymous survey that was led by the Ministry of Health with all of the 4 HMOs in partnership with the startup, Maccabi also sent out another survey that could be linked to the individual health records. And this was in partnership with a startup called Clara and with academia with the Weizmann Institute. Now at each of these interactions with the health system, whether in person or virtually, the data are systematically collected. The Maccabi central database captures all prescribed and purchased medications, electronic health records, which include outpatient and inpatient diagnoses, laboratory test results, hospitalizations, and procedures are all linked using the national ID number. On top of this level, we have automated and validated disease registries which draw on those different sources to facilitate disease management, also for many of the chronic diseases such as cardiovascular disease and diabetes. These also provide valuable tools for research, allowing us to quickly identify cohorts for epidemiological studies or recruiting patients to clinical trials. In Macchabitech, access to reliable data and skilled researchers allowed our epidemiologists to quickly answer some of the critical questions about COVID-19. Does hydroxychloroquine prevent infection? So when we were able to compare the prior medication use of those who tested positive versus negative, we could quickly see there was no evidence to suggest this. Do ACE inhibitors or other hypertension medications increase the risk of infection? Fortunately, there was no evidence that patients should stop taking their hypertension medications. What symptoms are specific to infection? So linking the survey data from the symptom survey to the other data in the Maccabi database helped researchers to understand that loss of taste of smell, for example, weakness and confusion, were symptoms that were much more predictive of coronavirus infection than cough or fever. And the ability to link those laboratory test results to longitudinal healthcare data for over 2 decades also helped to enable the development of predictive models to identify those patients at high risk of developing COVID-19 complications. One such model was rapidly developed in partnership with the company Media, who previously worked with Maccabi on several projects, including influenza modeling. And with another startup called KI, the Maccabi database and those existing registries were also able to quickly be leveraged to identify different risk factors for COVID-19 complications. And this also revealed some less studied risk factors such as depression. Now, in addition to the routinely collected data, Maccabi's biobank allows for the collection of blood and other biological samples in patients who consent to give a little bit more for research. This ambitious project was made possible by the existing infrastructure. Maccabi is quite unique as there's only one central lab that's serving all of the members nationwide. And thanks to the generous donations and research collaborations, we have also a rich data source here for studying COVID-19 and beyond. Serological tests are now planned to test community-level immunity, and together these different data sources and tools will allow for close monitoring of high-risk communities in Israel. Macchabitech's clinical trial arm will also play an important role in planning coronavirus vaccine trials, where phase 2 and 3 trials could be targeted to specific groups or areas using Maccabi's database. This could also facilitate early access to the vaccine. So as we've seen, the Macchabitech Epidemiology unit works hand in hand with teams leading clinical trials, patient-reported outcomes, big data, biobank, and this collaboration is rooted in the shared goal of generating real-world evidence and tools to improve health outcomes. Most of the Institute's activity is done in partnership with leading stakeholders in the healthcare ecosystem, including the pharmaceutical and tech industry, startups, academia, governmental and non-governmental organizations. In 2019, the Harvard Business School also published a case study describing this business model. And our long-term collaboration with Most, for example, has showcased the value of real-world evidence across many areas to inform policy and practice. Research projects often lead to some tools that can make their way back in a more direct way to patients, such as the development of an osteoporosis registry, which is used today in Maccabi in clinical practice and research. And when it comes to big data analytics, it may not be necessary to have all of the skill sets in-house to analyze all of this data. The partnerships have allowed Macchabitech to work with leading experts worldwide to benefit from innovative products developed. Before the COVID-19 era, for example, partnering with algorithmic experts led to the development of a colon score, which identifies patients at high risk of colon cancer using just one routine complete blood count measurement. So when a company called Medial was built around it, Macchabitech could use the method for free and also receive royalties. Another example is Maccabi's partnership with the digital pathology startup IBEX. Within less than a year, they developed and implemented a tool that's used today as a second read for detecting prostate cancer. Expanding access to the data available securely via a virtual research room has also been a pivotal step to open up the collaborations around the world. Research partnerships also contribute more broadly as a lever for economic growth. The clinical trial market in Israel, for example, was recently estimated at about $400 million. In the COVID-19 era and beyond, we can bring out the real value of data only by working together to find innovative solutions. Now, these partnerships, as you mentioned, in turn can help to support our health systems and economies more broadly. And Greece is now at a unique crossroads to leverage and expand its digital health. I look forward to hearing from the other speakers here today and to learning more from the Greek experience. Thank you very much.
Thank you for your contribution, Mrs. Weil. I would like to ask you a question. How do you think that the relationships with the startup ecosystem and the academia and the business sector, you had them already? Did the COVID crisis offer you an opportunity to intensify these relationships? I mean, without the COVID crisis, how things would have evolved in your country?
So as you mentioned, some of those relationships were already in place. Some of those examples, the first being the colon score that I mentioned earlier for detecting colorectal cancer. And some were new partnerships. And so there are definitely new opportunities, but also opportunities to strengthen existing collaborations. For example, our existing partnership with one company, Medial, was able to also leverage some of the previous work that we've done together in modeling influenza-like disease applications. And so we already had a strong basis there to adapt that to the COVID situation. But I think that for anyone, it's clear that the COVID-19 brings its own challenges and also opportunities.
Thank you. And do you have developed skills? You do not analyze just the data from the local population. I mean, you have developed the tools and the mechanisms to analyze any kind of data, isn't that? I mean, you can be a center of excellence in your country. I mean, yeah?
Absolutely. So some of the tools, some of the predictive models can be implemented in other settings in other countries as well as directly benefiting the local population.
Good, thank you for your contribution. And I would like to give the floor now to Megan O'Brien, the Executive Director from MSD.
Good afternoon. Thank you so much for the opportunity to participate in this panel. I'm here representing MSD from the Center for Observational and Real-World Evidence. MSD is a large global pharmaceutical company. We have active programs related to oncology, specialty and hospital care, and vaccines. We've recently announced a number of developmental programs to prevent and treat COVID-19. But today I'd like to touch on how the industry works with real-world evidence and partners with external groups. Now, we conduct clinical trials for our products, but beyond that, we have so much to learn about how our drugs are used, as well as the diseases and populations that they are used for and in. We need to partner with organizations such as Maccabi, we do, who have established broad and comprehensive data sources. We have a number of such partnerships in the US and globally, and we work in collaboration with researchers within these institutions to conduct real-world evidence studies. If Greece were to establish the data infrastructure, it would have the potential to become a real-world center of excellence. Some examples of where we could potentially work with the data that could be coming from Greece is during drug development. Epidemiology can inform understanding the natural history of the disease, development of relevant endpoints for clinical trials, and can provide inputs for economic models. Once the drug is available for the vaccine, real-world evidence can be used to better understand utilization and uptake, factors affecting adherence, comparative effectiveness, as well as understanding of the benefits and risks beyond what was captured in the clinical trials, as Clara described so many excellent examples. Along with the data from the trials, real-world evidence can inform health technology assessment decisions, as well as the development of clinical guidelines, and can help to inform healthcare providers and patients. Now, there are a number of considerations for the use of real-world evidence at any level of decision-making. Real-world data quality is the first. In order to ensure that the real-world evidence is appropriate and the quality that can be used with confidence, there's a number of key questions to consider. Data relevancy. Are the data complete? Do they include the right data elements? You may consider a case where you need to access lab data or prescribing data. Are those available? Are the appropriate endpoints captured? What is the length of time that patients are followed in the data, and are the data representative of the appropriate population of interest? Then there's a question about data quality. The accuracy, validity, completeness, and origins. Where do the data come from? And transparency regarding how the data was processed are essential in order to ensure that your real-world evidence is credible and when considering decision-making. Real-world evidence studies should also follow standards. They should have study designs, pre-specified protocols, data sources that adhere to the real-world data standards I described. They should have appropriate and validated endpoints, and a recognition that some trial endpoints can't be captured within health system data, as well as the comprehensive identification of confounders and appropriate methods to address bias. In the US, the Food and Drug Administration has issued draft guidance for the use of real-world data and real-world evidence as part of regulatory decision-making. And there are a number of examples where real-world data are used together with clinical trials for rare diseases. They're sometimes used alongside single-arm trials to create external control arms or historical control arms. Some countries have used real-world evidence in health technology assessment decisions alongside trials to inform decisions around reimbursement. There are some examples where HTA bodies have updated their recommendations based on the results of real-world studies that have informed additional benefits related to healthcare resource utilization or healthcare pathways. I'd like to conclude by saying, with access to high-quality linked data, Greece has the potential to become a center of excellence in real-world evidence, and these are just some examples for how the industry may choose to partner in the studies we may conduct. Thank you.
Thank you. I understand that we have managed to establish a connection with Sweden. Not yet. Okay. Then I would like to, I don't know, ministers, Minister Kontozamanis, you heard about the experience
Yes.
from Israel. And here we have the opportunity, since all the big companies, the health companies are here, and they have done some significant progress in the field. So what lessons can we learn? I mean, how can we build on this experience and we can grasp this opportunity that we discussed earlier?
We don't have to reinvent the wheel. We have the international experience. We know what we have to do here in the country, how to do it, and of course, we need to do it as soon as possible. The pandemic was a good example regarding Greece, how fast, how fast we can adjust to this new environment regarding the digital transformation of health, because when you talk about digital health, in essence, we are talking about the digital transformation of healthcare. And we strongly believe that this digital transformation is the vehicle to really offer better healthcare services to the population and build a strong and effective and responsive to all people healthcare system.
Thank you. And Minister Zarifopoulos, we have, as a country, we have progressed very fast with e-prescription very early, even from the beginning of the economic crisis back in 2010. Now we have a lot of data there. What is the progress in this field? How fast do you think that we can start actually building on this data and taking stock of this tremendous data that we have over there, with the prescription especially?
Well, it's all about data, and it's true that we need to exploit the vast amount of data that we have. The pandemic has definitely proven, I believe, to everyone, the value of data and how data can actually help us get through a crisis like the one of the COVID-19. Now, back to my introductory comments. Yes, the e-prescription data is a set of data that we already have, but we should not think that it is enough. We need to couple the prescription data with a lot more data regarding the Greek population when it comes to the health records of each citizen, their history, exams that citizens have undertaken. And when we have this complete set of data, then I think we should be able to leverage it, exploit it, and use it to the benefits of the health system and to the benefit of every citizen. So in a nutshell, to your question, yes, we do have a national prescription system, and it's one of the few countries, Greece, alongside Denmark and Finland, I think, that has a national prescription system. But that's where the opportunity lies. We need to couple that with the additional data, health records, and everything I mentioned earlier, to have a complete picture and then use that. Because if we want to talk about AI and the use of AI in health, it all starts with data. It all starts with good data that we then exploit through machine learning and technologies of AI in the near future. So it all starts with data. We need to complete the effort that has started with e-prescription. And that's why I mentioned, and I spent quite a bit of time during my introductory comment about the individual medical file for every citizen. I think that's the basis for then building these data sets to then move into AI and the exploitation and getting value out of all this data.
Thank you, Mr. Minister. May I also ask something that we have discussed in the past about the clinical trials, and Mr. Kontozamanis, what do you think on this aspect? What is the progress that has been made, or the missing steps yet that we need to take?
Thank you for the question. I strongly believe that there is a huge opportunity regarding clinical trials in the country, because we see, similar to the size of Greece countries, that conduct a huge amount of clinical trials, and this is good for the advancement of medical, for the research and development, and of course, it's very good for economical reasons, because it is an opportunity to create more jobs and create the...
And highly paid jobs, I mean, some
yes,
quality jobs.
Quality jobs, and of course, Greece has the opportunity to take advantage of its geographical position and become a hub in the region for clinical trials. We have a plan in our mind. We are going to deploy it very soon. We want to attract clinical trials. The government has already sent a signal to the market that we want to attract clinical trials to advance research and development in the country, and we have done it so far by stipulating in a specific article of law that we are going to
simplify, possibly.
We are going to
compensate.
To compensate, yes, the amount of clinical trials with clawback that is borne by pharmaceutical companies in the country. It is a very significant movement from the government, and we strongly believe that we will very soon become a very friendly country for clinical trials.
Not just clinical trials, I think all R&D,
R&D, manufacturing,
expenses in general.
Everything, yes, everything.
Yes.
So, this is our big chance now, because we don't okay, we want to transform the healthcare system through digital transformation, but it is an opportunity for us to contribute to the economy.
Indeed, indeed. Is it possible maybe to speak now to... okay, I see we are connected with Sweden. Mr. Lindblad, can you hear us?
Yes.
Okay.
Yes, I can hear you well, thank you.
If the connection is right, we are very glad to have you with us so we can have your contribution.
Yes, and
you have a few minutes though. You have a few minutes though.
Oh, yeah. Okay, first I would like to thank you for the invitation to speak here. And from a Swedish perspective, we are similar to Greece with about 10 million population and national registries with health data. And these registers are organized by personal number given to every Swedish person. Can you hear me correctly?
Yes, yes, yes.
Because I have a strong echo. Okay, no. Yes, then I just continue. In this way, every individual patient can be identified in these registries and used for research analysis across all the registries. And we have also quality registries in Sweden that build a national consensus among the medical professions on which patients to include in the registry, what treatments are given, and what patient outcomes are studied. For example, our first registry included patients with knee joint pain treated with joint replacement and followed with measures of pain and walking ability. But today, chronic diseases are the most common conditions, and the quality registry data on treatments and outcomes are centered around the patients during their entire disease course. So this real-world evidence data can be used in the interaction with patients to ensure that the patient is well informed and agrees to treatments prescribed, which improves adherence. The data can be used at visits both to the clinic and at patient interaction over the phone or video. Working in this way with outcomes data together with patients, we optimize the health for each individual, and this also forms the basis for a model of a learning health system that we have published in the British Medical Journal and also is available on YouTube to see how it works in practice. The registries on groups of patients with specific diagnosis or using certain drugs can be combined with the national population registries on prescriptions, hospital care, death causes, etc. Such analysis across patient and population registries are very useful in research on questions on the effect and side effect of drugs, on the costs of care, as well as post-marketing follow-up of new drugs. So in Sweden, we have a number of examples of real-world evidence can become a source of valuable information for the Swedish government, for the funders of care systems, for the researchers and care professionals, for the patients, and for pharma industry. So the advantages of conversations between all these stakeholders have also been described in a published paper. And I think that the key challenge in creating a complex digital health technology, particularly on a national level, as you are aiming to do, is not to do everything at once nor too quickly. All stakeholders should be participating from the start and stay involved in the long-term development and use, so all can see what's in it for them. And finally, I would like to congratulate you on taking this national initiative in Greece to develop a digital health ecosystem for the benefit of patients and the healthcare system. Thank you.
Thank you, Mr. Lindblad. I'm very glad that we managed to have this discussion, and let's hope that we will be able to collaborate also and see some lessons from you. Okay, sorry for this. I would like to thank everyone for the participation. I think there are examples, as Mr. Kontozamanis said, we do not have to reinvent the wheel. There are examples how real-world data are used, also at the research level, at the health ecosystem, and all the big companies are here. So I think it is indeed an opportunity for us to build on this experience and try to indeed to create value and maybe have a best practice here in Greece as well in this aspect. So I would like to thank everyone.
Thank you.
And goodbye.
Thank you.